afternoon. My name is Myschell Lyndle and I'm here to speak to you about the amazing work that Dr. Becky Inkster is doing around supporting the well-being of gender non-conforming persons. Specifically, the topic of being comfortable in your skin and how important this is to your mental health. I'm a practitioner in the aesthetics industry. Prior to that, I've been in the beauty therapy industry for 35 years. I specialise in the use of electrolysis for the removal of hair and blemishes. I'm very lucky to be in a position where I'm able to offer services and commissioned by the NHS to do so for the transgender community. So my role is just to support the transgender community by removing the hair, facial hair and body hair prior to surgery, and to be able to assist them in their journey. Now, I feel that this work is paramount to their mental health, especially since I've been working through the second and the third lockdown in my own clinic in Norfolk and also in a very well-known clinic in London, and have seen patients through their treatments consistently and been able to see the importance of this and how that's helped them along their journey and how it's helped to raise their self-worth and confidence. I have heard patients say that they have travelled from gender dysphoria to gender euphoria, which was the most amazing statement that I've heard, actually, to have a person come back to me after treatment to say that they feel a sense of euphoria after seeing the facial hair removed primarily. And this is something that really inspires me and drives me forward to be able to create the ultimate excellent complexion and to have the patient finish their treatment without there being any evidence that I've worked at all. That's my ultimate goal. I know I can get rid of the hair, and my goal is for the patient to have a perfect complexion when I finished. We work in the area of the body as well. I work with both female to male and male to female patients, and I see them through their treatments, and I witness when they embark on their hormone treatment. So I witness the effect of hormone treatment on my patients as well. And I notice that we are our hormones. So as we take on our hormones, so our bodies will change, our emotions will change, our feelings will change. And this is largely to do with our brain and how the hormones affect our pituitary and then our adrenals and androgens, and the ultimate effect on the hair production and the skin. So there is a big link between our brain and our skin. And our skin is also described as being our external brain, as we have all of our nerve endings in our skin, and we have the feedback to our brain through stimulation of the tissues and treatment that we may do, and also with the hormones that we may take. So there is a significant link between how we look and how we feel. And this is one thing that I notice with my patients as I increase the reduction of their facial hair and their body hair. I notice a difference in their skin when they embark on the hormone treatment as well. There is an improvement in their skin condition, and there is a change in how they feel. How people perceive my patients as well through their treatment, I see that as the hair is removed, often my patients will change the clothes they wear. They may change the company they keep. They may change their perceptions of jobs and careers that they may be able to follow. So it opens up doorways to lots of other areas of their lives, and this in turn will help their mental health because it will give them confidence, it will give them hope, and primarily hope is at the centre of everything that we do, to give the person hope that they will be able to live the life that they choose, and that they have a right to live. So I feel that my role at this stage in my career is a privileged role to be able to be part of the journey. And I fully support the work that Dr. B.I.E. Inkster is doing, to raise the awareness of the importance of the mental health, and supporting the well-being of gender non-conforming persons. One of my gender non-conforming patients, who is not actually going to go to surgery, just wanted the removal of hair, facial hair, in order to make a smoother impression when applying makeup. So largely I'm preparing the canvas for this as well, so that when a patient does decide to present female, that the makeup is smooth and that they don't have the shadow that would appear typically after a few hours. So there is also this lovely feeling of well-being, and a feeling of shining once the makeup goes on and the canvas has been prepared and the skin is nice and smooth. And I do find that the condition of the skin improves when we actually treat the hair, because sometimes we can find that there are bacteria living on the skin, in the follicles, that once those follicles are treated and the hair is removed, those bacteria will abate, and therefore skin condition will improve. So where there has been acne or spots from where the hairs are growing through, the skin complexion will then even out, and become less traumatized. So there's other benefits to having electrolysis treatment, hair removal treatment, for our gender non-conforming persons and our transgender persons. So all of this considered, I feel that this is a really essential part of the journey, and I have heard some of my patients start treatment and they're still not sure if they want to follow through to full surgery, but they definitely know that they want to feel more feminine by having their facial hair removed at the very least, and then we can have conversations, and after appointments with gender clinic, etc., then we can move on to body work if that's appropriate. So just really closing now, just to say that I just wanted to open up my heart really and share the stories, a few stories of patients that I've seen, comments that they've made. If I had £1 for everyone who said they wish they'd found me earlier, I'd be a very rich lady. So I'm very privileged, as I say, to be in that position where I'm commissioned by the NHS to do this work, and I treat patients privately as well at my clinic in Norfolk, where I am now. So please do comment if you wish. Dr. B.I.E. Inkster will have the links, I'm sure, to make any further comments or inquiries as to how you might seek more advice. I'm always open to questions, and happy to help in any way that I can. So again, my name is Myschell Lyndle, and I'm supporting the work here of Dr. B.I.E. Inkster, for our wonderful non-conforming persons and transgender community. Have a great day.